With that being said, it has been approximately 2 weeks since we last had our joint press conference. To my left, we do have the local health authority, Dr. Gutierrez, and to my right, we do have, representing the San Felipe School District, Superintendent Dr. Rios. We'll go ahead and begin at this time. Ms. Bruneda, I believe, has a directive. And present, it's my understanding that we do have present, we have KWMC 1490. We also have present with us today Connection Del Rio News Herald, Del Rio Buzz, KTDR 96.3, KDLK 94.1, and I believe KENS 5 is also going to be asking some questions for the entire audience as well. So thank you.
Good evening, city leaders. Also good evening to Del Rio citizens tuning in on the city channel and on their social media platform. My name is Javier Jr., KWMC Classic Kids 1490. My first question is to our superintendent of the San Felipe School District, Mr. Dr. Carlos Rios. Dr. Rios, are school employees going to get hazard pay at the return of school, like back in March when there was only 13 cases and now we're at 1,200 plus?
Javier, in March, the school district closed its doors and it sent everybody home. There were some essential people that had to come to work while everybody else was home. This included some bus drivers to deliver the meals, cafeteria workers, and some security officers, and on a limited basis, some secretaries. Everybody was home, yet a handful of people came to work. So we provided to them what we call premium pay, which is time and a half. It was the only fair thing to do since everybody else was staying home. Moving forward, we expect that everybody will come to work. So there will be no need to differentiate pay between those that stay home and those who come to work. But it was premium pay that we offered. It was never hazard pay. Now, should things worsen and the state call for people to stay home and we need essential people, then that is the school district's policy to offer premium pay.
Thank you, Doctor. My next question is to our Honorable Mayor of the City of Del Rio, Mr. Bruno Lozano. Mayor, we know through the course of this COVID months, businesses have been unfortunately shut down. They have been reopened. They have been brought up to 75% capacity and now brought back down to 50%. Given we're almost towards the end of our fiscal year, is there going to be any help for businesses regarding their taxes since they haven't been able to or be working at 100% like any normal past years? Any help for that?
That's a great question. So as far as the tax component is concerned, right now the city is currently budgeting the priorities for the fiscal year, for the upcoming fiscal year here, and we're ensuring that we're being very fiscally responsible in anything that may come about for the responsibility for the community that we serve. That being said, there are PPP loans that are out there for the federal government that businesses can apply for, and the city has recently produced 2 rounds of $100,000, the total sum of $100,000 to provide assistance for any local businesses that may have been affected due to COVID-19 at this time. And so information can be found on the City of Del Rio government website or City of Del Rio Facebook pages.
Thank you, Mayor. My next question is to our local health authority, Dr. J.J. Gutierrez. Doctor, is our hospital, are we still functioning at 100% as far as still having a maternity ward, other functioning services of the hospital, or are we a COVID-only hospital right now?
Okay, well, we're leaning towards a COVID-only hospital. We will never be 100% COVID hospital. We do have this is a local hospital. We need to serve the medical needs of the community, which means women who are pregnant and need to deliver, they still have the ability to do that. We have medical services, non-COVID medical services, very limited pediatric services. Our pediatric unit has been converted to a COVID unit. We have several COVID units, by the way. There's about 1, 2, 3, 4 COVID units at the hospital. So we started off with one unit, which was a 7-bed unit. Then we took over another unit that was 6-bay unit. Then we took over pediatrics, which was initially 6-bed, then 10, and then expanded to 17-bed unit. And all of those beds were occupied. And then finally we took over another, it was considered a COVID ICU. We took over that as well. So the scary part of that is if we have a critical non-COVID patient, we have limited resources for that. Now, of course, they come in the emergency room, they're going to be managed as well. We're going to have to, unfortunately, transfer those patients to San Antonio because we don't have the resources to handle a non-COVID critical patient. But having said that, we still have to provide medical services for the community. It's going to be scaled back quite a bit. We're still going to have emergency surgeries. We're trying to limit those services to a minimum. Obviously, if you have acute appendicitis, for example, you'll be taken care of course. But having said that, we're having to use our OR nurses to help out in other departments of the hospital, meaning med-surg, ICU, etc. So we're in a medical crisis, and it's all hands on deck. And sometimes that means having to transition OR nurses to other departments because we are limited on nursing, although we're doing better now than we were a week or two ago. But yes, we're leading towards, I don't want to say COVID only, because I don't want people to think, well, if I'm not COVID and I have a medical emergency, where do I go? We will take care of you. We will take care of you. But we're leading towards a predominantly a hospital that takes care of the COVID patients to a large extent.
Thank you, Doctor. Mayor, my next question is, our lake, La Presa de Amistad, as we call it, is one of the significant revenues of this city, this county. Unfortunately, it is closed. You know, a lot of families are taking this opportunity to go out there now and either on their boats or bank fishing. And other people are wanting to visit now with this downtime and visit our lake. Now that it's closed, there's businesses out there that are hurting. When can the city or county step in and at least open the boat ramps or a part of the lake or some for help for the businesses out there?
So while that is a great topic to discuss here locally, because our Lake Amistad is a precious gem for the community, unfortunately, the logistics behind supporting any major opening or reinstituting all availability and accessibility to the lake provides a great stress to the Department of Interior, specifically the park rangers that have to monitor all of that activity. Once you do get out there, of course, it is understood that they can socially distance on a boat and be out there distancing from each other. However, there are certain limited access points to those locations at the lake. And it's my understanding that Superintendent Ryan has tried his best to provide social distancing efforts, but he continuously sees violations of social distancing efforts that are mandated by the state and locally. So to provide extra manpower for that is pulling additional persons from their families to ensure that all that is enforced. So unfortunately, right now, we're going to have to take the hit as a community to protect the greater good of the public health. Right now, other communities, just like the city of Del Rio, Texas, are taking an economic hit when it comes to tourism. Specifically, the Gulf Coast cities are also requesting for their national parks and other state parks and beaches to be closed as well. Mayors and judges across the entire Gulf Coast are also experiencing economic losses locally due to the fact that tourism is affected. This is a great opportunity for the city and the citizens of the community to support local businesses to ensure that we're basically having staycations at home locally, support mom and pop shops and local franchises and corporations that have invested previously in our community. Use online services, do online research on who's selling services locally. And right now, any tourist attraction needs to be limited to groups of 10 or less, and we need to ensure that we're not exposing ourselves to members outside of our household.
Thank you, Mayor. Dr. JJ, this question is, what is the status of the federal and state help that was sent to the Rio Grande border cities and their impact in our hospital for assistance in this COVID-19 situation right now?
Okay. Before I answer that question, I want to just piggyback with the previous question about the lake, because I've been working with Mr. Chris Ryan, who is the superintendent for the Park Service. He and I have been going back and forth about what to do about the lake. And there's two issues, and one is people who want to go to the lake and just hang out, have fun in the sun. There's popular areas. of course, everybody knows that those areas become very, very congested, which is not good for COVID. You know, whenever there's people in large numbers, I mean, that's a feeding frenzy for COVID. The other issue, of course, is people who want to go out and fish, you know, go boating and fishing. Initially, I didn't have a problem with that because I figured what's the harm in going out and going fishing and boating? Unfortunately, there's a lot of people who take that opportunity just to kind of load up the boats in large numbers. They hang out in the areas of the loading docks. And I told Mr. Ryan, I said, I wish there was a way we could get people to go out there and have fun in terms of boating and fishing, because people want to do that in summertime. Now, the lake is open during the weekday. It's only closed on the weekends. So, but in terms of your question, okay, so we have a large number of deployed personnel who've come in all over the country, helping us big time. I mean, it's just a godsend that they're here. We have this awesome physician who's a Navy physician. He's board certified pulmonologist, critical care specialist from Bethesda, Maryland, and a whole nurses, RTs, respiratory techs. RTs are in high demand. You know, when New York was hit hard, RTs were hard to find. They were paying, you know, mega bucks just to get RTs to go to the New York area. So RTs are worth their weight in gold. A lot of administrative people, a lot of nurses, CNAs, medics. We have EMS trucks from different parts of the state. So we're getting a lot of help, which is sorely needed. It's a true blessing, especially since I'm having to take care of some of the COVID patients, to have a doctor like Dr. McKay, who's the pulmonologist. So I was up there today for half the day. It's just amazing how that unit, that upstairs portion of the hospital, just completely a COVID unit. It's impressive, like you're walking into this movie, a sci-fi movie. But we have lots of help. Now, we're going to stay on top of that because I know sometimes these people who are deployed are here for a short period of time and then they're pulled to go elsewhere. As I understand it, Dr. McKay, he said he'll be here as long as we need him. But along with that, we have a lot of ancillary services, and it's truly a blessing.
Thank you, Doctor. Mayor, with the city and the county averaging about 20 plus cases every day, do you see stricter enforcement, stricter laws in the formidable future for us here in Del Rio and Valverde County?
So as far as the enforcement or the strictness of an applicable law as it pertains to the city ordinances or the emergency declarations, we've done everything that we possibly can with the parameters that are given per the governor's declarations and executive orders. That being said, if the community does see any violations, we respectfully request that you report those incidences to the Emergency Operations Center at area code 830-775-2313. So that way we can ensure that the appropriate jurisdiction is responding to that incident. I can attest that we have responded to several cases of violations for mask orders or social distancing requirements, and we do try to respond to every single order or violation as quickly and swiftly as possible. Understand that this is a moving piece. The pandemic is sweeping across the entire community, and our resources at times are limited and are strained, and we may not respond as quickly as we would like to those violations. But I can assure you that the Chief of Police and the Sheriff's Department are working in tandem to ensure that we're properly responding to those occurrences.
Thank you. My last question was, fortunately for our county judge and yourself also, Mayor, unfortunately you're going to be here. With other cities and counties, their local officials, mayors and judges working together in unity, why has Del Rio been so apart as far as not working together between Del Rio, the city, and our county?
So I disagree with that perception. I do understand that perception is reality for the many citizens of our community, but I can assure you that the city has been involved from day one. As we all recall, the declaration was read by myself at the Emergency Operations Center, and I read the following declaration. So the city has been behind the support of all emergency declarations that were issued locally. In fact, the City Council went so far as to ensure that all of our declarations reflect what the county had declared prior to, so that we don't have conflicting and misinformation being presented or having to decipher two different types of declarations locally. Additionally, the City Council, and myself included, have continuously responded to any requests by the local health authority and provided any needs that they may encounter as this pandemic prevails and affects our community. We have countless meetings. We have countless phone conferences between the Emergency Operations Center, Emergency Management Coordinator, City Manager, county officials, City Council members, state legislation, federal elected officials. I mean, the list goes on and on. So the perception that we may not be working together, I think is not completely accurate. We have been working in tandem with all agencies. In fact, the school district had attended a couple of our meetings as well in preparation for the oncoming scholastic year, and Dr. Dios will address some of those concerns later. So we respond as quickly as we possibly can as the cases rise. I want to emphasize that the city and the county are working in tandem to the best of their ability, and whether or not the community perceives that workmanship is there, I think it's just the delivery and messaging.
Thank you very much. Thank you, city leaders. Thank you very much.
Thank you.
Hello.
Hello.
Mayor, Doctor. My name is Leo Sanchez. I'm with Conexión del Río. I have my questions are with Dr. Gutierrez.
Mm-hmm.
My first question is, do you project that from 2 years from now, the COVID-19 will still exist?
Wow, that's a good question. In the beginning, everybody thought that COVID-19 was going to be like a blizzard. It was going to come in here, do its damage, stick around for a while, and then we go about our business. And of course, with the summer coming around, we thought surely this is going to be a short-lived pandemic. This virus will hopefully behave like most viruses and die off in the heat of summer. And that hasn't been the case at all. Of course, everybody knows it's called a novel virus because it's new to us. We're hoping it would behave like other viruses, like other coronaviruses, but that hasn't been the case. So the question becomes, will it mutate and become more virulent, or more deadly? That's been a concern for a while, but from the literature I've read about the vaccines that are coming up, the vaccines will take into account a mutated form of COVID-19. So, of course, everybody knows that the vaccine will be available end of this year, first of next year. If it's a slam dunk type of vaccine that we're all hoping for, it should eradicate this virus, and it'll be much like the way it was for SARS and H1N1 back in the day. So 2 years, my God, I hope not. I mean, it's going to stick around till the first half of next year, but beyond that, I'm hoping it's gone.
Thank you. My second question is, we understand that there are 2 or 3 strains of COVID-19. Can you differentiate those strains and what it means to the community?
Yeah, I really couldn't give you a very informed answer for that. However, we thought about that. We thought about this could be a different strain that's going on in this area because it's more we're seeing a lot of serious illnesses, a lot of deaths, which we didn't see in the beginning, and so it just seemed like we had some cases in the beginning, but no one was getting very sick, and those who were sick weren't sick very long, and then all of a sudden, people were getting sick left and right, and the infection rate was going up. So we're thinking that there is a more I wouldn't say a mutated strain, but or a mutated virus, but a strain that is more serious than we've seen here in the beginning.
Thank you. My third question is, what is the truth according to some scientists using the mask not effectively? It's true, in what way does it help?
I'm a believer in masks. Okay, so for those who are saying it is not effective, you know, I disagree with that. I do know that people who wear a mask sometimes don't wear the mask very well, or white, and people when they have a mask on, they tend to want to touch the mask, and when they touch the mask, they may be touching their face and their eyes. So, you know, I know that there's been a lot of dispute about whether it helps or it doesn't help. I believe it does, because if you and I are walking in proximity, and you have a mask, I'm going to be happy to see you wearing a mask, because you may not know you have COVID, right? So you're protecting me, and I'm protecting you, because maybe I'm an asymptomatic carrier of the virus, and as long as I'm wearing a mask, I'm protecting you. So it goes both ways.
Thank you. My fourth question is, what really is the harmful effect of COVID-19?
Well, you know, the human body is the host for COVID-19, right? We are the target. We're the target host, but specifically, COVID attacks the lung tissue. That's the specific target of COVID-19, is the lung. That's why you hear about pneumonias that are killing people. So once the virus enters the body, it makes its way to the lung tissue, and that's where it does its damage. Subsequent to that, as a result of that, it can then, once you put infection in the system, in the lungs, things go bad. You become septic, which means there's bacteria now in the bloodstream, pressures drop, the kidneys are very sensitive to blood pressure, the kidneys can go south. You can put strain in the heart and develop a heart attack. But the primary target organ for COVID is the lungs. It wreaks havoc on the lungs. You get this huge cascade of inflammatory processes in the lungs. People are air hungry. And subsequent to that, you see unfortunate other end organ disease processes.
Thank you. And my last question. What is your message to our community to help understand the severity of COVID-19 pandemic?
Well, can you repeat the question?
What is your message to the community to help understand the severity of COVID-19 pandemic?
Well, you know, I wish, and maybe I shouldn't say this, but I really want you know, a picture says 1,000 words. And, you know, as I was there today, going from one unit to the next, it's like a scene from this crazy movie and I have to remind myself, this is Del Rio. You know, I have to remind myself when I see these people from all over the country coming to Del Rio, of all places. This is not the kind of notoriety that I was hoping for, you know, and it just boggles my mind that I'm sitting here talking to a physician from Bethesda, Maryland, only because we have a community that's so infected with COVID. Sometimes people think that if COVID hasn't affected me personally, I don't see what the big harm is. And that's what's going on right now. I wish we could have some sort of video demonstration of what's going on within the walls of Valverde Hospital, because it's unreal. You know, it just amazes me. I'm stunned at what's going on in our hospital, and I wish people could see that. Of course, you blur out the images of the patients who are fighting for their lives on the ventilator, but I wish we could have that image portrayed for people to see that this is for real. You know, people are out there thinking, it's nice and hot, and let's have what's going on? You know, what's the big deal? There is a big deal. I mean, look at the deaths we've had so far, and there's plenty more coming. I'm hoping we can do some sort of display so that people can see for themselves what truly is going on in our hospital. And not just that, but all the warriors out there, the nurses, doctors, the techs. We put our suit of armor every day and put our own health in jeopardy. People fighting for their lives on the ventilator. You know, that's what people need to see, and hopefully they can change their perspective.
Thank you.
You're welcome.
Thank you, sir.
Good afternoon, good evening. Can you all hear me okay?
Yes, ma'am.
I'm going to keep the mask on this time since we all have to use the same mic.
Sure, that's perfectly okay.
How many persons, oh, let me introduce myself first. I'm Karen Gleason. I'm the senior staff writer for the Del Rio News Herald. And the questions that we're going to be giving you tonight were developed by the Del Rio News Herald editorial board. How many persons being treated for COVID-19 are currently hospitalized at Valverde Regional Medical Center?
So as of right now, the data that has been given to me, it's accurate as of maybe late this afternoon. It should be updated also on social media websites. Part of the documentation that's showing here is that there's 20 current hospitalizations with 8 beds available at this time.
And is that information going to be on the new graphic that you all spoke about at Tuesday night's council meeting?
Correct. So this is a printed shot of what's going to be on this graphic. It's going to include the current reported cases. It's going to include the total reported cases, the amount of new cases since the last report, the amount of fatalities, new confirmed fatalities since the last report, pending results, hospitalizations, and various data. I know that the community had been asking for various demographical data, and it's going to be illustrated in this document that's going to be released on social media platforms.
Wonderful, thank you.
Mm-hmm.
Dr. Gutierrez, during the council meeting on Tuesday night, you spoke about having to send persons who are not suffering from COVID but who need hospitalization to other cities for treatment. And you gave 2 cases, I believe one that was a diabetic complication,
right,
and another person who had suffered from, I think you said, diverticulitis. How often is this happening?
Every day. I have a printout here of all our patients who are transferred to San Antonio. Some are COVID, most are non-COVID. Some are trauma. We do have some trauma here, so I mean that's a slam dunk transfer.
Right.
But by and large, we are transferring patients quite frequently. Now, we've been lucky in the last week or so. You know, just not too long ago, we couldn't get patients transferred out for nothing. I mean, we always had San Antonio in our back pocket in terms of getting a critically ill patient. We try to hold on to them. You know, we'll vet the patient. Of course, this is pre-COVID, right? We'll vet the patient, manage them, treat them, and then if things it becomes more difficult, we'll call San Antonio for high-level care treatment. Fast forward to the COVID era, we had a time frame where we could not transfer a patient. San Antonio was not denying patients. Let me make that clear. I know San Antonio got a little upset when they say, hey, Del Rio, we didn't say no. We just said we don't have any beds. They would like to take them. I know there's a little bit of a discrepancy in terms of how you interpret that. But I got some messages today from San Antonio saying, Doctor, we never said no. We just said we didn't have any beds. Now, lately, we have had some beds open up, thank God. And so our census is dropping a little bit. You see 20 hospitalizations. Last week was closer to 30. But as we transfer out, we also get some in. So whereas the ones that are somewhat ill, we are more able to get those out, even though we could probably manage them. We need to get them out because we have more coming in. So we are transferring out, especially the non-COVID patients, critically ill non-COVID patients. I'm sorry, we don't have the resources for them. But you know, that's the world we live in.
Got you.
And just to reiterate on the display, it says 20 hospitalizations. I don't know that it's 20 COVID hospitalizations. It might be. It's probably higher than that. Ed beds available. Probably not COVID beds. I'm certain. Yesterday I took the last bed available. And this changes from hour to hour.
It's a fluid thing.
So it's very fluid. So it's accurate in the morning perhaps. It changes midday, in the evening. So it's a fluid display. But it's a pretty good indication of where we're at. But I can tell you yesterday we didn't have any more COVID beds. As a matter of fact, we had to transfer out a couple. We got lucky. We're getting lucky in transferring these people out. But having said that, it's still a struggle. We're doing the best we can.
Also at the council meeting on Tuesday night, you talked about the hospital ethics committee again for the second time in 2 meetings. Can you kind of explain to Del Rioans and the readers what an ethics committee is, who sits on it, and what type of decisions that committee makes?
There's several physicians that sit on it. There's a handful. Dr. Lindsay, Dr. Manning, Dr. Rodriguez, Dr. Floyd, who's chief of staff, CEO, head of RT, respiratory tech, and then myself. I'm the chairman for the ethics committee. We never had to use a committee ever. I've been here for years and years. You know, never had the need for it. But we sit on there and we discuss the important thing, which is to have some sort of way to have some sort of objectivity in dealing with a crisis where people who are, for example, on the ventilator, and there's different models that we're using to try to put a number in terms of the severity of a certain individual. And that kind of gives us a tool to kind of deal with these issues that are present. So with the score that we have, we develop a score. It's not our own score. It's a score that we developed from other hospitals. I think the one we use is from Pennsylvania. But it's a way to triage patients, basically. We're doing triage in our COVID units, the more critical COVID units, and try to come up with a rationale that's transparent for everyone to see and objective. We actually eliminate the physician who's taking care of that patient, because we don't want that physician who's very much tied into that patient. We want that physician, it might be me, if I'm taking care of a serious COVID patient, to remove myself from that and let others come in and say, okay, this is where we're at, this is his score, and come up with a reasonable way to deal with a situation where we may have to withhold life-sustaining measures, which we've done, unfortunately. So that's the purpose of the committee.
Once the ethics committee makes their decisions or recommendations or does its scoring matrix, are those decisions also discussed with the patients?
Yes.
And their families?
Probably won't be the patient, because the patient's probably in the ventilator, right? But yes, with the family. And then we have what's called a triage officer who will lead that triage team. The triage officer, who is a physician, will have some support staff. And then they meet together, go over the numbers, see where the patient's at, and then come up with a plan of action, which unfortunately may not be something that the family may be happy with, but there's a way to arbitrate and discuss with the family in the event the family may have thoughts of their own that are contradictory to the decision of the ethics committee. But yes, there's a plan of action, and it's not anything we look forward to at all.
I can imagine. Val Verde Regional Medical Center reported that there is a delay in test results from Quest Labs for those persons testing between July 10 and July 20. How many people were tested, and what happened to those people? Were they advised to self-quarantine, and has there been a follow-up for those individuals?
Yes, so the hospital was using this lab called PRL in San Antonio. They're doing a fantastic job. We also have some other measures, other tests that we can get results fairly quickly. But in terms of the outpatient testing, they had to go to Quest. Quest was taking quite a long time, days, maybe a week, which in today's world, that's unacceptable. Back in the day, back in March, and we had to wait 4 or 5 days, it was like, oh, okay, well, that's the way it is. Well, 4 or 5 days is not going to cut it. But unfortunately, Quest was taking quite a while. And it's a reputable lab, but it took a long while. So Yes, and whenever they're swabbed, they're told to quarantine. People are calling. I know some of the people who are tested by Quest are calling saying, hey, where's my results? It's taking too long. But they're informed that once they're swabbed, yes, they do need to quarantine until further notice. Yeah, that's an unfortunate situation that's going on right now, although we're trying to limit our testing through Quest.
Gotcha, thank you. Mr. Mayor, can you please discuss the additional resources that have been or are being received by our community, military medical staff working at the hospital, and additional funding received from the federal and state government? How many doctors, nurses, et cetera, and how much funding have we received? And I guess Dr. Gutierrez could probably address some of that as well.
So Dr. Gutierrez may know the more specific numbers as far as doctors and nurses, but I can tell you that prior to the military coming to our region, through the federal grant or the federal opportunity that the governor endorsed or supported a couple weeks ago. Prior to that, we had several agencies come in and help the Valverde Regional Medical Center out through other agencies and other state agencies coming into our community. I know that at one point we had received maybe 14 to 17 additional nurses and staff to support the beds as they came online. And I know that the Navy has been instrumental in ensuring the support is there for our local hospital and giving a new perspective, because they were there, some of the frontline doctors were working in New York City, and now they're serving our community. And they're able to give that feedback directly from their experience in that metropolitan area here in our local area. So that knowledge and that information is very powerful, very useful for all the nursing and doctors and the hospital in and of itself. So I can attest that the support that we're receiving from various agencies is something that's welcomed locally. We embrace that. It's unfortunate, as the doctor said, the notoriety that we're receiving because of the COVID virus, but we're accepting all and any help that we're getting as far as support goes for the hospital. I can also tell you that various different organizations have been donating to the city, have been giving products and goods to us. One of the things that I can tell you that the community is now expanding globally. I mean, every single aspect of human life has been affected by COVID. The North American Taiwanese Chamber of Commerce has given 20,000 masks to the city of Del Rio, for example. We have a memorandum of understanding with one of the nonprofit organizations that receives extra food that we're going to be able to distribute to some of our local residents in case they have those needs, to provide that extra need of support. The city, for example, has continued to provide additional service for WIC and the elderly programs that we currently have, and that is oftentimes funded by federal dollars to support those programs, if not just local dollars as well. As far as federal dollars go, we have received the 20%, the initial 20% of the CARES Act, which is reimbursable, and we can use up to $1.9 million roughly from the CARES Act itself. And I can tell you that as the council convenes and as I listen to the needs of the emergency management coordinator and the local health authority, we're allocating funds to fulfill those needs. That includes additional support staff at the call center. That includes extra trace and tracking members for the local health authority. That includes paying for some support staff for the Dr. Gutierrez's needs as well. All this is working in tandem collectively as a community as we move forward. That's one of the reasons why the city council moved to support the appointment of the local health authority as Dr. Gutierrez, to ensure that continuity prevails, to ensure that every aspect, everything is covered, so that Dr. Gutierrez is successful in achieving what he needs to achieve, and that's helping combat this virus. Every day, every hour, we're getting various updates from various resources and agencies. And so whenever I speak to several elected officials in Austin or Washington, D.C., I convey that urgency, and we do get those resources. The hospital had initially asked for 50 vials of Remdesivir. We got 80 vials because of our persistence, our urgent needs, our urgency. Everything that we're doing is diplomatic in nature, because we need to ensure that all agencies that are making decisions, all elected officials that are higher up, are understanding that this might happen in their backyard too. Del Rio is not the only city that's going to see the effects of COVID-19 possibly rise as dramatically as it has. Right now, we're the first hit. We're the first major, we're the hot spot. Now we're seeing Florida, we're seeing California bounce back. So unfortunately, that's where we're at as far as COVID-19 goes.
Okay, wonderful, thank you. What is the status of the refrigerated truck or trailer the city and or county were going to purchase for possible use as a temporary mortuary. Is it here in town yet? What is its capacity, and has it been used as of yet?
So yes, the city did fund through COVID-related funding sources to deliver the refrigeration unit. I do apologize. This really hit me really hard when I saw it. It is here in town. It was delivered last Friday, and we're there. So we had to order it in preparation of the surge in cases that we're getting. If I may, we have confirmed now 49 fatalities with COVID-related deaths. And so we haven't had to use it just yet. The capacity is for 48 expired persons to be housed there temporarily as our mortuaries and as our funeral homes process the deaths as they come. I can tell you that it's real. It's reminiscent of the morgues, the temporary morgues that are in Kuwait. Some of the installations had them there, and it's very similar to that. It looks the same.
And the flood of '98?
It's very similar, yeah. And it's unfortunate that this is where we're at today, but this is why it's so important. I think it was asked by you, what's the important message that we need to deliver to our community? This is real. If you see that refrigeration truck, it hits you in a way that you cannot describe, because that could be your parent. It could be your grandfather there waiting, because the potential of a backlog at a funeral service exists right now. That's how quickly people are passing away.
Is there a special protocol or etiquette when dealing with people who have died of COVID-19? And why are the funeral homes reflecting a backlog? I guess whoever.
So I would respond in a way that this has completely overwhelmed multiple systems. I mean, it's not just overwhelming the hospital as far as bed space goes or nursing capabilities. I mean, when we say backlog, it's because something happens here, and that transaction, whether it's the movement of a person to another bed, whether it's the passing of a person and now that person is waiting to be picked up by a local funeral service or be delivered to San Antonio for cremation, or whatever the process is, everything just happens so quickly and it rose so rapidly that there may be a facility that can house a person, but all the logistics behind it to move this person is being used and utilized in various different places at the same time. So it becomes a domino effect. Exactly. So as far as the process goes for funeral services, each funeral home is going to have a different policy that is applicable under the current declaration per the state governor. You know, there's limitations in services rendered right now because of the fact that we also need to social distance, and that may impact their resources. They may not be able to provide social distancing within a service, for example, or they may have a policy where it's cremation only or quick burial only, because they cannot expose their staff to that positive case. And so there's different variables and variances that are happening with this entire pandemic on multiple levels and within multiple agencies. And so if anybody has a question as far as service goes, I'm just going to go ahead and lay it out there. My mom and I have already had a conversation about how we would like to be remembered if something happens to us. We've had these difficult conversations because a case may happen in our family. We don't know. There's no immunity right now. And if you're not having these real conversations with your loved ones and family ones on how to continue the services or continue life without that individual existing anymore, you're going to be rushed to have to decide, do not resuscitate or resuscitate, and what are the consequences of resuscitation because of this virus. I encourage our population, our community, to have these difficult conversations now and prepare and enjoy and embrace all the moments that you can have and make together now while you can, instead of having to recognize the fact that you're not going to be able to say goodbye to your loved one while they are separated from you because of COVID. And that conversation also needs to be had with funeral services and funeral homes.
Thank you. Dr. Gutierrez, could you please explain the procedure that's used to determine if someone died of COVID-19? So I know we talked, and I think one of my radio station colleagues asked the question last time, if someone is in a car accident that has tested positive for COVID-19 previously, and they die in the car accident, obviously the car accident is going to be the cause of their death. It's a little more gray if that person has like pancreatic cancer and then comes down with COVID-19. How do you determine what they actually die of?
Right. Good question. Yeah, I mean, there's certain circumstances where it's obviously the death was not COVID related. Every one of our deaths in Del Rio have occurred either in the hospital or at the nursing home. And each and all of them, every one of them had COVID. My diagnosis I worked with some death certificates today. My principal diagnosis of those deaths are pneumonia due to COVID-19. There's room to add maybe one or two more, and that's what's happening to some people. They have the COVID-19, they're dying from that. Now, as a result of the infection, sometimes the heart can take a hit, the kidneys can take a hit, so they may have had a mild heart attack in addition. As a result of the infection, they may have developed some kidney problems as a result of the infection. But the principal diagnosis is pneumonia due to COVID-19. And so we monitor patients every day. We do labs on them, x-rays. So yes, we're treating them for their infection, but we're also running labs on them. And so we're taking a big picture of what's going on with the patient with our labs and testing and whatnot. And so I know some people are in the mindset of, well, yeah, but did they really die of COVID, or did they died of COVID-19? Pneumonia, my diagnosis is pneumonia due to COVID-19. As a result of that, there may be a couple of other things. But the principal diagnosis is pneumonia due to COVID-19. And the unfortunate thing that Mayor Bruno was talking about with the trucks, refrigerator trucks, is that prior to that, while that patient's still in the hospital, the unfortunate circumstances in that is that as that patient is dying, or as a patient is fighting for their life, and then subsequently dying, the family members are not allowed to see their loved one. I know it's been a big topic of discussion. Why can't we see grandma or dad before they take their last breath? The policies are similar here or similar to elsewhere, where they're not allowed into the hospital. So the sad part is you don't have that moment before they pass on, which I think is very, very important. I've been down that road twice in my family. Obviously, a few years ago. Those are very important moments that adult children should spend with their parents or their grandparents, and those moments are taken away out of pure policy, necessary policy. And so it's very, very unfortunate. People are very upset about it, but that's one of the casualties of these deaths, is that those families don't have that time, that special time. You can't even get the priest, I believe, to go in there. So those are the topics that maybe don't make the headlines, but those are things we have to deal with day in, day out at the hospital. So, So we always assess the patient from top to bottom. It's not, we just don't focus strictly on the lungs and just hone in on that and nothing else. We do labs, we monitor the patient, but by and large, yes, every one of our deaths again happened at the hospital, at the nursing home, and they all have X-rays. They all show pneumonia due to COVID-19. Yes, there's some subsequent diagnosis that they have, but what got them to that point was COVID-19.
And as you said, it's an ongoing assessment throughout their treatment.
Exactly, from day one till the date of death.
Thank you. Have counties or city officials received reports of local employers not properly following social distancing and safety guidelines with their employees? And how many of those reports have you received? And then what is the procedure in those cases?
So I can answer for what the city has received. I have received several reports either directly, the community, the citizens just let me know, either via phone or if they see me in passing, and I relay that information to the city manager and police chief Knoll, so that way we can ensure that it's within the jurisdiction to go check up on it. And if it's not within our jurisdiction, I know that Chief Knoll and Sheriff Martinez have a great working relationship, and the sheriff takes responsibility outside the city limits of Del Rio, Texas. I also encourage the community, once again, I'll repeat the number, to report any incidences of violations with any orders that are in place, whether it's the governor's order, the county's order, or the city's order, to report those cases to 830-775-2313. That's the Emergency Operations Center number, and we do have personnel available to take those reports and relay them to the appropriate jurisdictions. As far as how many, I can't tell you exactly today how many. I don't have the specific number, but I can tell you that initially it was a bit higher than we would wanted it to be, just because people were adjusting. And as COVID was hitting communities and hitting Texas, the declarations were changing rapidly, and either the restrictions were being lifted or not. But now recently, I can tell you from what Chief Knoll has specifically mentioned to the city manager and myself in conversation, is that the majority of employers are complying. They're taking this seriously, and we see a decrease in those kind of reports. As far as the procedure for these cases, again, we do have law enforcement respond to those cases, and it's on a case-by-case basis, the severity and the type of action that's taken further to the business and business person. So,
thank you. Local officials have repeatedly stated that the majority of our COVID-19 cases have come about because of social gatherings, whether in someone's home or in an event center. What steps, if any, have been taken to reduce the number of these gatherings, or to inform citizens that these gatherings are unsafe and attendees may be spreading the coronavirus further?
So I can tell you, as far as what the city's taken, the steps that I've taken specifically regarding the social gatherings is I've followed the guidelines for the governor. The governor did declare that we can provide variances or exceptions to any social gathering event, maybe a wedding or even a funeral service for that matter, any variances that may have 10 or more gatherings, and I have not provided or allowed for any variances to proceed. I can't answer if the judge has or hasn't followed those directions, but the governor did give that authority within the jurisdictions of the city or the county. I've taken a very strong stance. I know initially I was trying to support opening up the creek. As the local health authority described, once the creek opened up, we saw like clockwork cases rise, and because it's virtually impossible to get enough law enforcement, to get enough city employees to properly enforce the code of social distancing. So the city council, we all voted to support the closure of the creek again and any access point to the creek. And that's going to be similar to what Chris Ryan, the superintendent of Lake Amistad, is trying to facilitate by keeping the lake limited or closing it over the weekend. The fact of the matter is that this is the responsibility of an individual. Are you properly addressing the fact within your household and educating your household that social distancing does work, that sharing, that meeting up with your cousins or your tias or your uncles is a way that this virus spreads? We need to make sure that we're educating the public that social distancing means you can't hug your grandma if they don't live in your household. And you need to trust your family members when they tell you, I haven't seen or been to other friends' houses, I haven't been there, because if they're not telling you the truth, I can tell you that the trace and trackers will find the truth regardless. They'll figure out that no, your aunt did have a gathering. They played bingo on a Friday night with 5 other women, and they're all positive too, and maybe a couple of them are now at the hospital. It's factual data that is traceable. So as far as another thing that we've done, I can tell you that I've taken a firm stance. I've requested the city and the community to support the 21 stay-at-home request. We're not going to see any results of that until another 2 weeks, because that's the nature of the game of the virus. You know, this is patience 101. If we don't take action now to reduce our exposure to the public, which means each other, everybody here is social distancing. This is what works. If we are closer in proximity, that's when the virus has an opportunity to jump from one person to another. The mask is a layer of protection. My messaging has been consistent from day one. Social distance, wash your hands, wear your face mask, monitor your symptoms. That's so simple. I think the public is waiting for this miracle drug right now because that's what we're used to. Technology has gotten us so far. But unfortunately, there are simple actions that we can take control to help mitigate the spread of this virus. And again, the messaging has been very consistent from me specifically. I know I've said it several times, over and over. Wear a mask, social distance, wash your hands, monitor your symptoms. So I can tell you that that's what the city has done, and I will continue to be, whether it's popular or not, I'm going to try to my best to protect the public to the best of my abilities with the direction of the governor and the authority from the governor, and I will not be allowing any variances whatsoever. If there are violations of gatherings of 10 or more, I encourage you once again to call 830-775-2313 and report those violations. This is a public emergency, and we all need to take responsibility for our actions.
Thank you, Mr. Mayor. This last slate of questions that we've prepared is for Dr. Rios. And Dr. Rios, these are from our education reporter, Atsimba Morales. First of all, what is the plan for the bus routes?
To answer that question, I first want to express a tremendous amount of gratitude to all of the parents who have selected remote instruction. We have a significant number. We only have 35% of enrolled students who will be returning to school on a day-to-day basis.
Wow.
35%, that's it. What that means is that everything that we do will be on a much smaller scale. Usually we transport over 3,000 students. Right now we're expecting to only transport around 900 students. Transporting only 900 students and having the fleet of buses that we have will allow us to take every safety precaution that we would in the classroom. Take every student's temperature, ensure that they're wearing a mask before they board the bus, ensure that there's social distancing within the bus. So the routes are going to run as they normally would run, but only because we are going to be serving less than a third of the students that we would normally serve with the same manpower and the same resources.
Wow, that's extraordinary. Has the school district reached 100% contact with parents regarding education models?
As of this morning, we had reached 95% of the enrolled parents. That's significant because usually we deal with 3 to 4% when they're coming back to school, having to do schedules, fixed schedules. So 95% is pretty much as close as we're going to get, and it's been excellent. Thank you so much to everybody who's been working overtime. We've called people who are usually off for the summer to come in and make phone calls, and they've done a great job. So we've been able to reach just about everybody.
Wonderful. What are the current percentages for each education model, students in need of electronic devices, and students in need of internet?
We have 35% of the students have indicated, or their parents have indicated, that they're going to come to school via the traditional model day to day. We have approximately 54% of the students that are going to do 100% online. And then we have a little bit over 11% that are going to do the hybrid model. I fully expect that when the students experience the fully remote model for the first 4 weeks of school, I expect that that number is going to go up a little bit. It has significantly gone up since the pandemic started gaining strength here in Del Rio. So I expect that before we come back to school on September 16th, we'll have even a higher number of students doing remote instruction. Of the students that are going to be doing remote instruction, about 26% of the students, or about 2,400, have indicated that they need a device, and a little bit under 600 have indicated that they need internet connectivity. And to that end, we're working hard to make sure that everybody has what they need to be able to learn at home.
What steps is the school district taking to ensure all students will be able to take the STAR test without issue?
Again, we expect that when students are going to be taking the STAR test, we expect that so many of them will be taking it online.
Gotcha.
So in terms of how they will take it, we expect that a whole lot of that will be online by that time. But more importantly, to be ready for the test, we've had a whole lot of people working to make sure that our curriculum is as strong as it can be, because it is going to be delivered mainly via remote instruction. Make sure that the platforms that we use are easy for students and parents to understand. and making sure that both the instructional documents and the platform can very easily work together so that students can experience 100 times more rigorous instruction than they did when they were doing homework packets back in March.
What procedures does the school district have in place to address a positive COVID-19 case on a campus?
This coming week, a lot of our principals, teachers, and parents are going to be reviewing all of these procedures. We formed some focus groups to review the elementary supplemental student handbook, which is supplement to the regular handbook that addresses all COVID-related items. Same thing at the middle school and same thing at the high school. The procedures that are going to be followed are pretty much what the state has outlined. What would happen if a student was to become positive? What would happen is that the class for the rest of that day is suspended. The whole room is sterilized. Everybody who was in proximity is contacted. The school does a thorough review to make sure that social distancing was maintained, that everybody was wearing a mask, and do everything possible to make sure that there's complete awareness, but more importantly, that it was contained so that it wasn't spread at school. I'll give you one great example, or a few great examples. We did our summer athletic camps, and unfortunately, there were students that told their coaches that they had been in contact with somebody who was COVID positive. When that happened, and it happened on more than one occasion, we notified the students in that group, we suspended that group, and members of that group that were suspended, a whole lot of them went and got tested. But because they had maintained social distance and worn a mask in transition, there was, at least not to my knowledge, there was no incident where the COVID-19 was transmitted within those camps.
Wow.
Students went outside and were cruising in a car with other students, and it was that proximity that caused them to catch the virus, but it wasn't within the organization. And we hope that we can maintain the same type of social distancing in the class. We don't hope, we know we will, because we're planning for it every day, and that the results will be the same.
Wonderful. When will the school district begin allowing parents and students to check out electronic devices?
In our planning meetings, we organize it in such a way that starting today, the technology departments were going to the campuses to start staging the devices to start being distributed on Monday, this coming Monday. This week, a whole lot of parents, particularly parents in K1 and 2, were contacted so that they would come pick up the device this coming week. So this coming week, we're starting with K1 and 2. We're also starting with the freshman campus, early college high school, and the blended academy. The following week, we'll do the next grade levels. So we've already started contacting parents. We started staging the devices today. We'll start handing them out on Monday. But it isn't where you drive up, you're being contacted. We're finding that the personal attention, the phone calls to everybody, it's just working really well. It's labor intensive, but at the end of the day, it just helps organize everything and makes this very difficult transition very attainable.
Thank you. Will the school district continue providing meals to the public during the school year, or will it only provide meals for SFDR students?
The way we provide meals is governed by the Department of Texas Agriculture, and we have to take their guidance. Over the summer, they were very lax in the rules, and we could distribute the meals even outside of the school settings, and parents are driving up, and if a parent drove up and said, I have 4 school-aged children at home, we gave them 4 meals. We didn't ask if the students were enrolled in a private school, in a charter school, or in a nearby community. We handed the meals, because that was the rules that were outlined by the Texas Department of Agriculture. The new rules indicate that we can continue to hand meals to students that are being instructed from home, but there has to be accountability. So now, instead of driving up and saying, I have 4 kids at home, you have to say, I have 4 kids at home, and these are my 4 kids, these are their names, and these are the ID numbers. and then we'll hand you the 4 meals. So it is going to be different.
Gotcha. In regards to TEA's recent announcement on Tuesday for school funding, has there been discussion of taking legal action?
I assume you're talking about the letter that Attorney General Ken Paxton issued, and then the response that TA had.
I'm going to assume that that's what Zimba's talking about as well.
Okay. In the past, there were some communities outside of Del Rio where either the county or the city had made a declaration, an executive order closing everything down. And because there were so many and there was a whole lot of cases that were happening, TA moved a little bit away from the rule and said, well, we initially said that you could do 2 weeks, but now you can do 4, maybe 8, and maybe longer. Well, in that process, Ken Paxton, Attorney General, came up and he says, no, the city and the county cannot issue an order thwarting another law of the state. So the city and the county cannot dictate if a school's going to stay open or closed. Now, if you stay open or closed, if you stay closed because the city or the county issued a proclamation, well, then we're not going to fund you. We're going to fund you only if you are open to those that want to come to school. Well, when Ken Paxton, the Attorney General, said that, TA came right behind and said, oh, by the way, we're changing our rules again, and now we're not going to fund you. But that doesn't affect our community, because in talking to the mayor and the judge, they've always agreed, and it's not that we've pushed them one way or the other, they've always agreed that the best equipped people to make the decisions about what happens at the school is our Board of Trustees. Our Board of Trustees indicated or approved the calendar that we shared with them that said that we delayed the start of school by 2 weeks, and then we would go 3 weeks remote instruction. So we've been in line with what TA has discussed all along. So those rulings, we're not a party to that mess. Okay. And that's the way it should be.
Awesome. Since 5th and 8th grade students are not required to pass the STAR tests this year, what requirements is the school district following in order to promote them to the next grade level?
We still have to see how TA or the subcommittees will make the rules. This past time, there was no assessment because the students didn't take the STAR test. But still, TA came back and said you have to come up with a criteria to determine if students are going to be promoted from 5th to 6th or from 8th to 9th grade. You can't just say everybody passes. I expect that TA will come back after the year begins and indicate the same rules where we have to use local assessments, a combination of adequate progress made, but we won't be able to make that determination until probably January at the earliest.
All right, thank you. And gentlemen, thank you very much for your time and patience.
Thank you.
Thank you.
Good evening, panel. My name is David Galindo. I'm with Del Rio Buzz.
Good evening.
I had about 8 different questions sent my way, and I whittled it down to 3 because I didn't want to keep going and going. But here's a question that was asked by 2 different people, which I asked on the last time we were here. And the question was, there does not seem to be a consistency in usage of event centers. For example, the Civic Center is not being rented, but events that are outside the city limits are. Well, I guess really we need a yes or no answer. Are there weddings going on in the county?
So again, I would refer that question to the county officials. I can tell you again, within the city limits of the city of Del Rio, Texas, I have not allowed for any variances as have been described for the governor's declaration and orders that were released on July 2nd. So there are no authorized gatherings of 10 or more within the city limits of Del Rio. As far as the county is concerned, I would deflect that question to the county, as it's a different jurisdiction.
Yeah, because this one keeps popping up, and I don't drive out in the county and look around for this
It's
stuff.
understandable, and I would refer that, again, the governor did give authority to the mayor and judge of each respective municipality and county to provide variances.
Okay. Has there been a correlation showing people who have come down with COVID-19 were exposed who have come down with COVID-19 were exposed by visiting the San Felipe Creek. The 2 weekends before you guys shut down the creek, I walk around and take pictures on the creek. I almost saw no people. I mean, I got pictures that show there's no people on the creek on those afternoons and evenings. But is there a reason why?
Again, I would defer the coalition as far as the cases to Dr. Gutierrez, but what I can attest is that I know that the chief of the police did see some rise in social gatherings of large numbers that were hard to provide social distancing enforcement opportunities. As far as the coalition, I would defer that to the local health authority, Dr. Gutierrez.
Because a lot of us didn't see anybody down there.
Again, I did get that information from the police chief during that time, so.
Okay, there seems to be no standard within the city when it comes to going to work if you've been exposed. Example, Code and Compliance Department of the City of Del Rio shut down for 2 weeks because someone from the department tested positive. A different City of Del Rio department had someone test positive for COVID-19, but that department remains open. Does the City of Del Rio have a policy in place where all departments follow the same protocol?
So yes, there is a policy currently in place as far as the departments are concerned. Right now, the city has a limited amount of staff that are working in municipal buildings, and it is closed to the public at this time due to the fact that there had been a rise in cases throughout the entire city. So when you're referring to this, it may have been during the beginning when we received our first positive case, and at that time, it was a moving piece of information that we had to respond to. And so the first incident, it's my understanding that there were a couple of positive cases, which is why it may have been extended a lot longer than the other department. But because of the current situation and the current surge, all departments, if they can work from home, are working from home. And the city manager does update myself and the city council if he's bringing anybody back online. I can tell you that there will be some employees coming back online to work that really work outside and can provide the platform for social distancing.
Okay, well, thank you very much.
Thank you, sir.
Dr. Can you hear me?
Yes.
Dr. Judge Gutierrez, thank you. Bruno Lozano, our mayor. Dr. Rios, thank you so much for all that information, the great information you provided to us today. I'm Sergio Diaz. I'm representing KTDR 96.3 and The Rock 94.7. We cut it down to 3 questions. This way we don't sound so repetitious. Question number 1, how effective are travel restrictions and quarantines in our city?
Dr. Gutierrez, would you want to respond to that as well in addition to me? Because I can. So I'll begin by stating that limiting the exposure that you have with persons outside of your household is extremely effective because you're not out there exposing yourself to potential positive cases that are asymptomatic. So I would say that limiting your exposure outside of your household is extremely effective. As far as travel restrictions, you're free to move about the city and county as you please. You're free to buy a ticket and fly somewhere or take a train somewhere. There's no restrictions as far as that is concerned. I can tell you that the Department of State has implemented certain restrictions to certain hotspots, and I know there are certain states that are limiting and quarantining inbound passengers to their respective states, and even different regions in the globe are limiting inbound customers to their respective countries. As far as restrictions go, we can see that where the success rate has been effective in the country of New Zealand, for example, where they have 0 positive cases because they're limiting the amount of inbound passengers and visitors to their respective country. So it is definitely effective. The problem that arises is, I think, the education of what a household or family member is and how that relates to, can I travel to this place? What am I going to do to protect myself from others and protect them from me when I get to that location? So I'd refer the rest to Dr. Gutierrez if he can provide any additional information.
You know, back in March, this all started here in Del Rio. We were very strict in determining, a hotspot. We would ask questions, about travel. Travel back then, back in March, was, have you been to Seattle? Well, and those are some of the hotspots that the CDC asked us to ask. Have you been to Seattle? Have you been to New York? Have you been to Europe? And those are the questions we asked back then, because those were valid questions to ask. Well, it didn't take very long to determine that you know, those are those are no longer applicable. We were dropping those questions because next thing you knew, every place was a hotspot. And so fast forward to now, I mean, it's kind of scary to think about people who travel to areas that are where the numbers are through the roof, you know, Houston, Dallas, for example, Austin. So we transitioned from, have you been to Seattle, to have you been to Dallas? And now it's, have you been to the north side of Del Rio? So things have changed quickly. So sometimes, and that's what we're talking about, there's a difference between a household and a family member, and family. Some of your family are not part of your household. And we're seeing a lot of cases where people think, you know, what's wrong with family spending time with family? I mean, that's what we do, right? But there's a lot that goes on, and we're seeing that. It's proof that the numbers don't lie. And a lot of our cases are family members affecting other family members. And surely when you have one household member that's positive, there's a high likelihood that others in the family may be positive as well. But how did you get to that point? You got to that point because one of the positives was probably spending some time with another family member in the other side of town or down the street. So things have evolved quickly. You know, have you been to Washington? Have you been to Houston? Have you been to San Felipe? You know, so these restrictions are necessary. I know that some people think, well, why do a 21-day stay at home when people at home are infecting each other? Well, how did you get to that point to begin with? It's because you're spending time with other family members, other friends. You know, people think, well, family A was quarantined for 14 days. Family B in Port Aransas was quarantined for 14 days. No one's affected, so let's all get together. You know, I don't know if I'm comfortable with that. And I've had to deal with that with my own family who live in other areas where there's hot spots. I say, hey guys, I love y'all, but right now is not the time. So these things are important. We're seeing them play out day in, day out, and people just think that there's absolutely nothing wrong with spending time with our brothers and sisters and cousins and aunts and, you know, so forth. But it's playing out, and the numbers are through the roof, and that's one of the reasons why our numbers are so high right now.
Thank you. Question number 2, how can people avoid or reduce social stigma associated with COVID-19?
So as far as the stigmas associated with COVID-19, I'm going to deflect back to a time in history, which is in the 80s, when the HIV pandemic was quickly spreading through an often stigmatized community as in and of itself. The LGBT community oftentimes was called the gay virus. And there was a lot of stigma that was associated with HIV, that if you came out as gay, you had the virus automatically, there's no truth to that. The very fact of the matter is that HIV is a human virus. All humans can get the virus, just like COVID-19. At the beginning, there was a stigma that, you know, you were going to get it if you were older or if you were super young, and this middle age range of humans would be asymptomatic, and we would get over it rather quickly. The fact of the matter is that misinformation is probably what caused the virus to spread so rapidly to the older populations, because we, the young, healthy population, were asymptomatic and hugging our grandparents and, you know, gathering with our aunts and uncles that are older than us, and we inadvertently gave it to them. And now, you know, as Dr. Rios can attest, when the students came back from Europe after traveling, it is no fault of their own that they got the virus. It's nobody's fault that this virus is spreading between humans, because it's exactly that. It's a virus. Just like the common cold or the flu. People are going to get sick. People are going to have cancer. But for some reason, there's no stigma with cancer, because it's just that. But oftentimes people are saying, well, you didn't do this, or you didn't do that, or I can't go to the creek, I can't go to the lake, I'm stuck, I'm tired, I'm frustrated. Every single person, not just in Del Rio, not just in Valverde County, the state of Texas, the United States, I'm talking the entire globe is experiencing this simultaneously. And similarly to the HIV virus, when it began in the 1980s to affect a community, to affect persons that were dying for unknown causes, that's what happened with this virus. In the beginning, people were wanting action from elected officials, from state agencies, from the WHO, from the CDC, to take quick action. unfortunately, when the virus was first being discovered or being researched, there was little data. There was little data provided. But it was a lot easier to blame somebody for having gone or visited a hotspot in the globe. That the reality is that anybody can get it. It's a virus that affects the human species. And until we can actually have conversations with each other and educate each other on how the virus spreads, we're going to continue to have this stigma. But I continue to advocate for everybody in this room and all listeners that are joining in right now. Stigma is just that. Educate yourself. You too can get the virus. How would you feel if you're being targeted on social media because you went to Italy as a student to go visit what every single person does during spring break? How would you feel that your grandfather died of COVID and you're blaming yourself because somebody read on social media that your grandfather died? How would you feel about that? This is going to affect every single person in every aspect of life for years to come. Right now, we're suffering this today because people are frustrated. We all gathered, every single one of us on this table, every single one of us as elected officials are having to make decisions that we never would have thought otherwise. And stigma is going to permeate without education, without actually having empathy for another person or individual that is experiencing this. I know people that have passed away from COVID-19, just as I know how people have passed away with HIV. And I am an advocate for HIPAA and for privacy and for not targeting any single individual in our community. That is one of the reasons why I choose not to go out and find positive cases from social media posts, because that's not my role as a mayor. It is not my role to pick on any individual and say, you should have done this, you should have done that, you should have stayed home. It's impossible. I'm giving solutions to a possibility to support our local community, our local economy, and support and visiting each other. And it's a simple, I'm going to say it again. You can visit somebody if you social distance and stay 6 feet away. Wear your mask, wash your hands regularly, and monitor your symptoms. We can do all of that. We're doing this now right here in this press conference. You can go to a drive-thru and support your favorite restaurant. You can call ahead. You can call the mom and pop shops and support that. You do not need to blame an individual for testing positive for a virus that affects every single human being on this planet. That is complete irresponsibility on us as humanity to blame and stigmatize somebody for a disease they have no control over.
Thank you. Last question, Dr. Gutierrez. Will COVID-19 persist next year as a pandemic?
Yes, it will. I mean, we're in June right now, or July, I'm sorry. School is just around the corner. The time flies, right? Although I have to say that from January to July has just drug on and on and on. I know everybody in years past, people think how quickly the year just goes by. And I said, I wish the year would just slow down. And I'm sorry I said that because, we've gone through a very tough time this year. But having said that, it does fly. School is around the corner. I don't see anything that tells me that the numbers are dropping. I'm hoping. As of right now, I'm not seeing any sort of improvement or a trend that we can count on to say, wow, we're turning the corner. I'm hopeful, though, in the weeks to come that we can get to that point. But, just like we thought that the virus would would die an ugly death in the heat of summer, which didn't happen, right? I'm worried about the fall where viruses tend to run rampant. So I'm a little fearful. I'm not trying to be Dr. Buzzkill, but, I'm fearful for what might happen this fall for many reasons, but that's going to carry on to the winter. It's going to carry on to the early part of winter for next year, January, February. We got hopefully that vaccine coming around the corner. I think that's going to cause a huge dent in trying to rid ourselves from this virus. So it's going to carry on through. I mean, it's crazy for me to say that. I mean, back in March, I thought, well, surely, a couple of months, it's going to hit us, and we'll survive, and it'll be like any other illness that comes around. But I mean, this is incredible what's going on in this world. I mean, we're living in a time that we can look back and say, man, we went through COVID-19, and no, it's not going to end in December. It's going to carry on. But I'm hopeful that once we get that vaccine, and I think it's going to be a slam dunk vaccine, that it'll put a huge dent in terms of ridding ourselves from this horrible virus.
Gentlemen, thank you.
Thank you very much, sir.
Hi, my name is Courtney Capitan, and I'm from KDOK 94.1. Can you hear me okay?
Mm-hmm. Yes.
Thank you.
Mayor, through what medias are you informing the citizens of your voluntary stay-at-home order?
Through which media portholes? I didn't hear the first. Which media?
Through which medias are you informing the citizens?
So through social networks, the City of Del Rio government webpage is what we've been targeting for the most part.
Have you considered sending out mailers or flyers?
We haven't considered it just yet, but that's actually an opportunity that we could possibly look into. Yeah.
Do we have plans to increase restrictions in town further than the present state if cases continue to rise?
To answer that question, I would throw it at the community in and of itself. The city has done everything it possibly can to restrict and inform and educate the public on what we can do to control and mitigate the spread of COVID-19. If the cases continue to rise and overload resources locally, countywide, statewide, there will be decisions made further up the ladder, maybe perhaps at the governor's office, that may impact our restrictions right now, and those restrictions may exceed what we currently have in place. Right now, we're trying to promote everything voluntarily, because if we can flatten the curve locally, that will be a positive for all of us. We can't stop this virus, but we can slow down the spread so that the case and workload doesn't overwhelm our hospital and our medical groups here. But as far as more restrictions, I would leave that in the hands of all of us.
Okay. What do you expect the case counts to look like 1 month from now, realistically?
So for me, and talking with Dr. Gutierrez and other agencies across the state, the outlook is not really optimistic at this point due to the fact that flu season is upon us. It's on the horizon. As seasons will begin to transition, we're going to see flu cases affect all of our community. And from my personal opinion, we haven't seen what that looks like. It hasn't happened yet. Flu was at the end of its season when COVID was beginning to rise. And so those two different viruses interacting with each other and how it affects the human body hasn't been experienced completely just yet. And as previously mentioned, many medical leaders were alluding to the possibility that COVID-19 would slow down and that there would be a significant drop in cases during the warmer months. But that never happened. So we're not only did we not go down in cases and flu starts to kind of go up too, we're up here with COVID, and then we're going to slowly go up, and we don't know what that's going to look like come September, October, and in the winter. So as optimistic as I am that we'll get through this, which we will, and hopefully once the vaccine is found and discovered and promoted and released to the public, until we get that, I honestly foresee a very challenging fall and winter.
So the worst is yet to come for Del Rio.
I would expect not just our community, but globally.
And doctor, is that something you'd agree with?
I was hoping you would ask that question to me. Gosh, like I said, people call me Dr. Buzzkill, Dr. Gloom and Doom. I guess the thing is not to be pessimistic, but to be realistic. Optimistic would be nice. I'm looking at this number, 1463. I mean, remember back when we were at 13 and 14? And just like, it's almost like, I wouldn't say one day to the next, but I mean, it's just incredible. It's just unthinkable that I look at these numbers and think this is Del Rio. I know it ties into school. I know school is a big issue right now. I know a lot of parents are fretting and deciding and pondering and trying to figure out what's best for their children. And I know parents don't look forward to being teachers. I know there's online and structured and virtual, but a lot of that requires those young kids to be, for the younger kids to, for those parents to be at home, or a parent to be at home. So it's a lot, there's a lot of angst about the school year. Could this drive our numbers higher? You know, it's a good question. You know, I'm afraid that this might do that. Then we're expecting that surge to happen, right? We're expecting a surge to happen in the fall. I don't know if this 1463 is due to a surge. I mean, we never let up. I mean, yes, we were 13, 14, and just kind of just went up and up. So there was not, I don't see that as a surge. The numbers are up, yes, but it's not like we went down and then all of a sudden we went up. We were thinking that our numbers would go way down and then expect the surge to happen in the fall. So it's scary. But, you know, having said that, we can. I mean, Del Rio is a community that it'd be kind of difficult to ask San Antonio or San Antonio or Houston or Dallas to rid themselves of the virus. It's such it's a large community like that, metroplex. But aside of Del Rio, you know, where we're at, the good thing about Del Rio is that, well, we're a small town, which can be good and bad, right? The good thing about it is that we're away from the big cities, but unfortunately, it's in our backyard. The sad thing about being in Del Rio is people thought, well, these are big city problems. You know, what does COVID have to do with Del Rio? Those are things that happen in San Antonio, and Houston, and New Orleans, and Seattle, and New York. What does that have to do with Del Rio? So people kind of got in the comfort zone that this isn't going to happen to Del Rio. And surely, as we let our guards down, and we don't follow those things that we ask people to do over and over again, that's why we're sitting at 1463.
So on that note, besides asking citizens to stay home and mask up, what else can we be doing to slow the spread? Not only as the government officials, but as citizens, what more can we do?
I mean, those are the things that, I mean, if you get a bar of soap and wash your hands, you're literally killing the COVID that might be in your hands. I mean, people think, well, that's kind of silly. No, it's not. I mean, soap does kill COVID. A hand sanitizer can do that as well. The alcohol in the hand sanitizers can destroy the virus. It's not a alternative to washing your hands, but it's the next best thing. So, as numb as people want to feel towards those messages of distancing, hand washing, et cetera, I know people get tired of it. They just want to puke when they hear it. Oh God, here comes Dr. Gutierrez saying these things over and over again. People get tired of it. But let me tell you, COVID never gets tired of infecting people and killing people. You know, they're hoping that we take our a day off and rid ourselves from the masks and whatnot because it's a feeding frenzy for COVID. I know there was a question about the use of masks. Well, can you imagine? You know, our numbers are 1463, and a lot of us here in town have been using our masks. Can you imagine what these numbers would look like without using the mask? That's the question that people should ask, right? What would happen had we not been using the mask?
And I would also just add that, you know, what else can we do? I would say be vigilant of your surroundings. If you get invited to go to meet somewhere at a park and you see a large gathering, don't go to the gathering. Like, walk away and tell your friends, I can't, because I'm protecting myself, and I'm also protecting all of you from me because I might be asymptomatic. We need to educate our children on why we can't hug grandma and grandpa if they don't live within the same household, and those families work or do other activities that might expose the children to the virus and be asymptomatic as well. We need to empower our youth. We need to give them some kind of hope. You know, with starting school activities, it's just to provide some sort of normalcy of what previously existed prior to COVID-19. But ultimately, we all need to adapt. We need to adapt to the fact that right now, this is the reality that we're currently all collectively experiencing, and hopefully in a year or two we'll have a vaccine. But we have to also think about the worst case scenario, that vaccine might not work. The virus might mutate. It's a virus. That's the nature of viruses in and of itself.
Thank you. Who will be responsible for providing masks to children, especially those for low-income families? And on that note, have you decided that children going back to school are going to be required to wear masks?
So the short answer is yes, and the school. But let me say a little bit more to what has been said about everything that's going on, because the school plays a huge role in this. I know that there's a lot of concern, there is a lot of angst about students coming back. And for me, the biggest angst about students coming back is that may send the message that it's okay to come out of your home and socialize. And that's the last thing we want. But that's the only concern I have about coming back to school. I'm excited about the opportunity, whether it's through remote instruction or face-to-face. I'm excited about the opportunity that we're going to have to shape the community. Because up to this point, we've talked to the community through social media. We've made speeches that sometimes go in one ear and come out the other, if they're ever heard. You know, when I think about education, I think about the most noble profession. And right now, the two most noble professions that are so essential to turning this pandemic around is the healthcare profession and the teaching profession. The healthcare profession, God bless them every day for going to work and meeting the virus face to face. There are communities' true champions. Incredible. And then here comes the teachers. If we think about the history of the United States and how we have transformed from one stage of our country to the next, the schools have always played a vital role. You know, so I'm looking forward to the day when our teachers can see their kids, whether it's through the computer or face-to-face, and educate them truly about COVID-19, practice with them about wearing a mask every day, educate them on what to do and what not to do. It's going to be an incredible opportunity, and that's where the real education in our community is going to start. And then we're going to take it one step further, and we're going to work with the parents. Right now, the parent handbook that we've developed, you know, sure, it has all the protocols that we have to follow, but the very first thing we're going to do, we're going to seize the opportunity to talk to the parents about how we as individuals can help keep our families safe and keep everybody else safe. So everything that everybody's been talking about, you know, don't do this, do that, you know, we're going to get a chance to have a one-to-one conversation with everybody, and that's huge, and I'm really excited for that part. Now, having said that, we also have a big role to play in keeping everybody safe. That's why those parents, the 55% of parents that have chosen to keep their kids at home, that's why we are incredibly grateful, because we think you get the message. You understand how serious the situation is. And for them doing that sacrifice, you know, we're able to focus on everybody else and hopefully drive that message home. And for parents that have to work and you have to send your kids to school, then we want to be there for you, but education plays a big role. So we're hoping that when every student goes home, they'll be the individuals that tell their older brothers or their aunts and uncles, you have to wear a mask. You know, you can't come over for a barbecue, et cetera, et cetera. And for that, teachers, you know, you are going to be so well remembered throughout as being one of the people that reshaped the course of history here in Del Rio. Now, we've bought a whole lot of masks. We've bought a lot of face shields. We've bought a whole lot of resources. Nobody's going to come to school and say, I didn't wear a mask because I didn't have one that fit me, or I couldn't afford one. There's going to be masks for everybody. We already have hundreds of thousands of them, and we'll certainly buy a lot more. That's just not going to be an issue.
Okay, that's good to hear. So who is going to be ultimately responsible for teaching the children safety measures and enforcing them? If it's the teachers, are they provided with information and training on pandemic education for children? And who is that information coming from? There's a couple of venues. I shared some material with our local health authority, Dr. Gutierrez, and I asked him to review the material to make sure it was appropriate before we put it on our handbook.
So obviously, we're not making that determination. We're relying on our local health authority. And then the next part is obviously our teachers will get trained. There's also curriculum that our program, our Del Rio Cares program, the culture ed program. There's also curriculum that we'll be buying for the additional lessons that we'll be providing. So our teachers will deliver it. They'll definitely get training on it. It'll be vetted and ultimately approved by Dr. Gutierrez. Now, the material also comes from other health authorities, so I doubt he's going to have too much trouble with that. But we are excited about that part.
Good, I'm really happy to hear that. Are there additional resources available for school staff, such as free testing? The staff, for the most part, at least at the school district, and that's the only one I can answer for, our insurance covers 100% of the testing. Okay. Okay, Mayor, has the city added additional tracers since the last press conference? How effective have they been? And what are they doing to educate and inform the citizens that they contact about the importance of social distancing and other measures?
So as far as the city adding tracers and trackers specifically from our entity, we're continuing to support the local health authority to ensure that the needs are properly assessed. And as of right now, the county has been the main entity that's been hiring the trace and tracking support group for the local health authority. The city is in a position to continue funding those services and additional needs as they arise. And with the appointment of the local health authority, we can also hire them directly as the local health authority gives us that data information to support his needs. And as far as educating the last segment of your question was as far as social distancing, I'm confident that the trace and tracking team is supporting all of the local health authorities' directives as far as educating those positive cases on the measures that need to be taken, and I would ensure that message is properly met by the local health authority.
So as we've discussed, Superintendent, this question is for you. As we've discussed in this conference, the lake is dangerous because of the high traffic at the entrances. Do you not think the school bus entrances and the entrances to the school building would fall under the same category?
No, we're talking about an unstructured setting, which is the recreational areas. In the school, we're talking about a very structured setting. Our principals and our parents and our teachers, they've worked to map out every inch of the school to make sure that students keep social distancing when they're coming in, that their temperatures are taken, that students walk directly to a classroom supervised by other adults so they can maintain social distancing. We're talking about a very structured setting that is going to take a whole lot of vigilance to enforce, but we really believe that we have the cooperation of every individual that's going to come to work, every adult, and that's why, even though there's a whole lot of concern, and rightfully so, we think that we have taken every precaution to make sure that everybody, especially our teachers, because they're the ones that have to be the catalyst of everything good that comes forward, that everybody is safe and structured. If it isn't, then we couldn't continue. I would just add that our Board of Trustees and our administrative team, they've always been, at least when it comes to the schools, they've always been ahead of the decisions. Back in March, we closed schools down before it was even mandated. We took that step. We had personnel go home and not even have to come to work. And we're doing the same as we began school. Nobody is going to make a decision that is in any way a knee-jerk reaction or that doesn't consider how grave the situation can become if this goes wild. But we're not. We're organizing something that's very structured. And if we thought it couldn't be structured, then we would be the first to say, we're talking about even drawing safe zones around teachers, 6 feet apart, where you can't come in within that square, just like we're keeping the desks apart, like we're keeping the eating room. Every single detail of the day is being planned out. So we're confident that it's going to be very structured, and on top of that, that we're going to get to educate a large part of the community about what to do to turn this around on a conversation basis, on a me and you talking, the teachers and the students. And even though this hasn't happened yet, I'm just so proud of our teachers because that's a power that they have. They really have that power because they have more rapport with parents and with students than anybody else in the community, more so than me or anybody else. So it's difficult and it is trying, but it is going to help the situation in our community.
Have you discussed another shutdown of the schools, and at what point would we get there?
If the cases were so high that it was just we were low on manpower because teachers just couldn't work, then that would certainly be an indication of it. Now we know in our plans that teachers aren't going to get sick at school because we're going to protect them. We're not going to put them in proximity of another student or another adult that's not wearing a mask. I mean, we're talking about not even having teacher lounges where they go and eat, not having teachers make copies so that nobody congregates anywhere. We're talking about structuring the day 100%. Now, we also expect that we're dealing with professionals, with educated adults that aren't going to break these rules for their own safety. So we really don't think that would happen. But I mean, that is obviously possible because anything's possible if we ran low on manpower. But if we follow the orders that the doctors have said, 6 feet apart, wearing masks the whole time, plenty of hand sanitizer, everything very structured, we should be safe.
So based on what you just said, you don't think the reopening of the schools will cause a spike in cases in our town?
No, ma'am. I do not think that reopening, now please understand, I'm talking about with the numbers that are coming to school right now. That's why I am eternally grateful to all the parents, to the over 50% of parents, 55% of parents that are keeping their kids at home. That makes that 35% that's coming every day very manageable. If that 55% weren't staying at home and the other 10% weren't doing a hybrid situation, then my answer would be different. But given the 35% of students that we're dealing with our entire workforce, it is very manageable. And my only fear is that students that come to school think that, okay, it's safe to go everywhere because obviously we're going to school. And that's where that education piece is so crucial. So the situation right now, I want to say it over and over again, with only 35% of the students coming to school day to day, we're able to maintain social distancing everywhere and structure it, but only because we have that small number of students coming to school.
Okay, thank you. And this is my last question. It's for all three of you. Speaking as a citizen, not as a doctor, a mayor, or a superintendent, how do you feel about the future of our city, economically and in terms of individual well-being?
Well, I just finished giving a discourse. Maybe I can at least go second.
Okay, Dr. Gutierrez.
Repeat the question, please. I couldn't hear it.
Yeah, as a citizen, how do you feel about the future of our city in terms of individual well-being and economically?
I still can't hear your question. I'm sorry.
Yeah, I heard it. I'll answer it. Is that all right? Yeah, how do I feel about the future of our community? Obviously, I am concerned, but I absolutely know that if we continue to have conversations, if we continue to make hard decisions and educate the individual person about the hard decisions, I know that we can beat it. And I'm betting on the willpower of every individual to wake up and make those decisions. And I'm very optimistic that situations will get better. That doesn't mean they're going to get better when I walk out the door, but it absolutely means that they are going to get better because I believe in everyone's kindness to make better decisions given the right education. And I absolutely believe that we're going to turn this thing around. But unfortunately, there are going to be more positive cases, and there are going to be more of everything that's terrible that comes with this until we can educate everybody. But ultimately, within the next few months, I think there's going to be so much education, so many conversations, very compelling conversations where we're going to start to see the best part of all of us come out.
Will you continue to attend these press conferences?
Anytime we're invited, I've gone everywhere. So yes.
Good.
Oh, well, I mean, that's the good thing about us as a country. You know, when in a crisis situation, we always rise above. You know, where I'm not trying to get all to blow this out of proportion. You know, actually, you know, in early April, we had a little video demonstration or display. It was myself, some other leaders. I don't know if you remember that back in end of March, early April. And I was going to jot down some notes about what was going on in the country. And believe it or not, I think it was like April 3rd-ish. I wrote down some notes. And at that time in the U.S., there was only like 3,000 deaths. And, you know, my point of contention was, you know, we're under attack. And I know some people didn't believe that back then. And maybe there's some people that still don't believe in that premise that we're under attack. And I wrote down some notes saying that we were at 3,000 in the entire country. In the 9/11 terrorist acts, there was about 3,000 people that perished from that attack. You know, so I was trying to get, my point was, you know, we were an attack from that ordeal, 3,000 U.S. deaths. At that time, we had 3,000 U.S. deaths from COVID-19. And you look at the numbers now, it's like, my God. So, I mean, we can't turn this thing around. It's, if anybody has any concerns about, or if everyone should have, what should scare you is once school starts, and I think there was a question here that was supposed to be asked about what happens if we get a surge as a result of that. Kids, you know, potentially get infected, spread to the family. There's this huge surge that happens. Does a hospital have the capabilities to handle that huge surge? And the answer is not really. I mean, we're struggling as it is right now in the heat of summer. And we're almost at capacity. I don't want to say we're at 100% capacity, although yesterday evening I took the last bed. Things are fluid, but we're very well near capacity. I don't speak for Linda Walker, who's a hospital CEO, but we're just about there. Can you imagine if we get that huge surge in the next couple of months? So that alone should make people wake up and say, you know, we can't go through this. We've gone through this already. And people are still kind of numb to the idea that this is not very serious, but if you can't do it for yourself, do it for your kids, do it for your grandparents. And then it's not just a COVID situation, it's a non-COVID situation, like I said earlier. Non-COVID patients are having to deal with the realities that we may not be able to take care of you here at this hospital, and you're going to be shipped away to San Antonio. So those are thoughts that people should think about and take serious, because there's some people here, some people that still don't take this very serious. But I'm hopeful that people will wake up. You know, we have different battlefronts. My battlefront is dealing with COVID patients in the hospital. Actually, I feel safer in the COVID units where there's COVID everywhere, wearing my warrior suit, which is my full bunny suit, face shield, goggles, gloves, double glove, you know, everything. I'm impenetrable. I'm more scared here, actually, than I am at the COVID unit, because here I'm just wearing a mask. So I'm hoping, that's all we can do is hope that the message finally sinks in that, bad choices have horrible consequences. And that's what we're seeing right now. And it could potentially get worse if people just don't wake up and see that we're at the brink of a potential brink of a horrible catastrophe for this community.
So I guess that leaves me to answer your question. As far as not answering as a mayor, I'll answer as a person who grew up here in Del Rio and as Ralphie, as my nickname goes. As Ralphie, I like to just, commend and acknowledge the fact that we're a community that is tightly knit. We have very unique cultural values that permeate every single family unit here in the city, here in our area, and it's something that brings us all together. Our culture is often, we try to define our culture, and it comes with family. It comes with this certain lifestyle, this certain aspect of community and building that relationship with each other. Oftentimes visitors come to our area and there's no stranger because everybody's so welcoming. That's oftentimes what we hear from visitors that come to our community. Laughlin Air Force Base, the wing commander, Colonel Gentile, and now Colonel Prather has already stated that we're such a welcoming community. And Colonel Gentile reflects that with his involvement in our community. He says there's no other place like Del Rio, Texas. There's no other place. So with that being said, I think that because our community has that culture within itself, it's in our blood, that I can attest that we're a resilient community. Back before the Amistad Dam was built, there was floods that impacted Ciudad Acuña and Del Rio, and then the Amistad Dam helped prevent those floods. Then collectively we experienced the flood of '98. And we experienced a tragedy that affected every single person in this community. My family welcomed my classmates. I was a freshman in high school. We welcomed so many individuals into our home so that they could take a moment to bathe. We invited their families. We invited their parents to come to our home because we had access to water to use our resources. That's what we do as a community. We open our doors to each other. We open our hearts to each other. We support each other, whether it's in person, whether it's mentally, or whether it's through compassion and empathy. That's what our community is known for. We're resilient because of that experience collectively. I grew up here, and I remember even Dr. Rios being in administration when I was in high school. These are the memories that we've all collected. I know his father. Dr. Gutierrez came to my elementary class. These are the people that inspire each other to do the greatest job that we possibly can, and that is to be there for each other. I think that I have an optimistic approach to the outcome of this pandemic for our community. I want to ensure that we have faith and continuity of all agencies, that we will prevail and we will overcome this tragic moment in human history right now as we all collectively experience the pandemic. I think that the fact of the matter is that we continue to shape our future right now with all of the decisions that we're making collectively, whether it's through the city council, whether it's through commissioner's court, whether it's through the school board or any other agency. We're doing what best we can. And as Ralphie, I admire every single administrative component, every elected official that is taking the time to come prepared to these meetings, to educate the public, to make decisions that are the best possible decisions to make, given the excruciating circumstances of this pandemic. I'm very optimistic that with that leadership, we will prevail. I'm optimistic that all of our business leaders here are adapting, are changing their business plans to accommodate social distancing, that are changing their business plans to accommodate online orders, to accommodate those business plans that deliver products locally, so that every single person in our community has accessibility to those services that they provide. Right now is the time to think outside the box as a business owner so that they can be successful, so that their business can continue to grow. Those adaptive businesses are going to be the ones that can possibly inspire businesses in New York City. We have entrepreneurs here in Del Rio. We have artisans that reflect all culture. We have musicians that can do online virtual concerts that we can all log into and enjoy from the comfort of our own home. I'm confident that our community can be inspired for hope, for love, for compassion, for empathy to prevail against this pandemic. As far as the economic impact, right now every single community is financially impacted. Every single walk, every single agency, I'm sorry, not every single walk, but every single agency is impacted right now. Every economy that's codependent on tourism specifically is going to have an excruciating amount of financial burden because of that tourist dollar. Right now is an opportune time to invest in our infrastructure, to invest in strategic places of monuments that can attract, that can provide for social distancing measures. Right now is a perfect opportunity to ensure that we're supporting different congressional acts that support infrastructure investment in our community. One great example is the Ports to Plains Alliance that has been 20 years in the making, and now it's moving that much closer to coming to fruition. Right now is the time to work collectively to ensure that that interstate system can come through our community so that we have accessibility to future trade needs. USMCA passed right before the pandemic hit. What an opportunistic time to ensure that jobs are being created here in the United States. Here in Val Verde County, we're already getting inquiries to invest in our community. I have complete optimism and hope that we're going to continue to attract more investors in our community, not just because of the USMCA, but because of other strategic opportunities that our community is prevailing on. As Dr. Rios mentioned, educating the students and having our teachers empower those students during this COVID, during this pandemic, they're going to be our future leaders. And if they can get through this most challenging time in their scholastic life, they will be bringing success stories to our community. I have hope for the youth. I have optimism for the youth. And lastly, I want to say that we're right now on the precipice of a paradigm of shift of the human experience. Right now, the entire globe is adapting to this pandemic, not just Del Rio, the entire globe. We are part of that human experience collectively. Every single one of us is part of that global population that can adapt, think outside the box, provide solutions, provide resources, give time, volunteer, do whatever you can to get through this pandemic. Mentally, physically, collectively, we can get through this. I have nothing but hope and optimism that one day in years to come, we'll look back at this pandemic and say, Del Rio has never been stronger. And that's the hope that I have for our future as Ralphie. And as mayor, I will ensure that I make the best decisions possible to ensure that we do prevail and we put our name on the map, not just for COVID, but for the successes that happened because of COVID.
Thank you very much.
Thank you.
We done?
I think that's everybody, correct? All right. Thank you very much, everybody. And thank you, media, for being here present. And I want to thank Dr. Rios and Dr. Gutierrez.
Thank you.
Much appreciated. Absolutely. We'll see you again, sir.
Okay. We'll talk.